and WCCSradio.com at 12 minutes after 8 o'clock. So, yes, indeed, IRMC has a lovely little walk-in clinic on the main campus, and it's a really busy place, and that's a good thing. This morning we visit with Brianna Kerr. She's a PA there, and she is going to be with us here to talk about the walk-in clinic at IRMC and how it can really be helpful for you and for your family's health. Good morning.
Good morning. Thanks for having me.
I'm glad that you're here. Our visit is presented by Marcus & Mack, voted best law firm and best personal injury lawyer 3 years in a row and the best of Indiana County contests. Visit them online at marcusandmack.com. You haven't been there since the very beginning of the walk-in clinic, but for a good long time.
Correct. Yeah, the clinic opened, I believe, in the spring of 2022, and I started there a couple months after, around the fall.
Yeah. So you know the ropes there, and probably you know the rhythms of it, because when you have that sort of a format for medical care, seasons and the various things that impact somebody's health, they follow into a pattern, don't they?
Yeah, they sure do. It's kind of weird, actually. Even over the past 3 years, seeing the pattern of we all go to school starts in the fall, cold and flu season, right? That lasts till about February, March. The weather starts to break. Spring comes, and we kind of have a period that just a little bit of everything, still a little bit of sickness, a little bit of summer stuff, rashes, bites, stuff like that. And then, of course, summer rolls around, and we look at a lot more, again, rashes, bites, tick bites, lacerations, just all of the things that come with summer.
Yeah. Every season has its own challenges, and certainly you're quite aware of that. The numbers that we read, the statistics that we read, show a surprisingly large percentage of our population does not have a primary care physician.
Yeah.
Is that a role that the walk-in clinic can fill?
Yes and no. So we do not serve as a primary care provider. Despite the name, don't let the name fool you, we are an urgent care clinic. You can compare us to the Indiana Urgent Care over across town, as well as the Blairsville Urgent Care down at Chestnut Ridge. We work very closely with them. But we can establish patients with a primary care provider. So a lot of times when we have patients come in for any type of walk-in visit, no matter the visit, we always like to recommend a follow-up with their primary care provider. Depending what the complaint is depending on the amount of time. We were seeing a lot of pneumonia. Okay, we want you to follow up with your PCP within 2 to 5 days just to make sure that you're getting better, things don't get worse. So we do not serve as a primary care provider, but we do encourage all of our patients to be established with a primary care provider just so they can have appropriate follow-up after our visit.
I can picture people coming in and getting the care that they do there and saying, but I like coming here.
Yeah, it does happen. It does happen.
Yeah, that's not a bad thing either.
No. So our office definitely can help with that. We have an all-inclusive list of local primary care providers, and generally we do ask patients when they come in and offer, hey, I can provide you with this list if you want to call yourself and make your own appointment, or I'm happy to have, my staff call and get you scheduled for an appointment for follow-up. So.
The resources that are available to you as a walk-in clinic at IRMC, that has to be a tremendous advantage.
Yes, it is very nice. Just being close on campus and close to the emergency department, and obviously we kind of have a plug-in with other IRMC specialties as well, so that helps out a lot.
Yeah, absolutely. All right, so there are new hours, extended hours.
There are, yes. So we are currently Monday through Friday, 8 a.m. to 8 p.m. So we are not open on the weekends, but yeah, Monday through Friday, 8 to 8.
And why was that? Is it because of just the volume of people that you're able to see?
Yeah, so I think a big push for that, especially this time of year, again, with the school starting and cold and flu season starting, you think your normal 8 to 5, 9 to 5 jobs, right? It's hard to get in to see for medical care during those time periods when you're working or you have kids in school. So a big part of that, too, is just to help serve the community and also to help take some of the weight off of the other clinics who are open, the Indiana and Blairsville that are open until 8, and now, we're right beside the ER too. So just to take a little bit of the volumes off of those clinics as well.
Yeah, so you've sort of explained why people would want to come to a walk-in clinic. Expand on that, if you would, a little bit. What are the types of things that you commonly see at a walk-in clinic?
Yeah, so a good general way to explain it would be a lot of things that, if you feel like you need to go to your primary care doctor and you can't call and get in, and you feel like you need to be seen within the next 24 to 48 hours, most of that stuff we can take care of at the walk-in clinic. Not all, but most. A lot of stuff that we see, lots of ear infections, lots of sore throats, lots of cough and colds. Of course, any type of, chest discomfort, shortness of breath, any of that stuff is generally better served in the emergency department. But, we do see that and we can, appropriately transfer people if we need to. Lots of urinary tract infections, school physicals, sports physicals, driver's license, just really anything that when you think of an urgent care, lacerations, we can do all of that.
This time of the year, you mentioned physicals. This is a really big time for those.
It is, yes, yes.
So sports physicals, work physicals,
Yep.
Those sorts of things. There are some places where employment, part of your employment is the actual taking of that physical early.
Correct.
And those physicals can be pretty valuable in identifying potential problem areas.
Yeah. So we do all of those. We are available, and you can walk in at any point to do those from Monday through Friday, 8 to 8. We do lots of driver's license, lots of sports physicals. Generally, if you have a pretty complex health history, we kind of would like those to be completed by the primary care provider, just as essentially just to provide better care. But ultimately, especially with young kids, sports physicals, driver's license physicals, young healthy kids, we do a lot of those.
And the nature of a walk-in clinic is you can just walk in.
Right.
It's
right.
not an appointment-based type of thing.
Correct.
Can people call for appointments, or do people just generally walk in?
We do have a handful of people that call and want appointments, but we really don't schedule them. For the most part, when we have two providers there, we're able to get you in and out pretty quickly. So we usually just recommend, hey, we'll be here all day. Just stop in whenever you can.
Yeah. We're talking this morning with Brianna Kerr from IRMC's walk-in clinic. For folks who don't know, exactly where is it and how is it connected to IRMC?
Yeah, so we are located on the hospital campus. If you come in off of the main entrance right by Mack Park, not the 6th Street entrance. If you come in, and we're actually just the first building on the right-hand side, also just directly across from the emergency department.
Yeah, really easy.
So there's a really nice parking lot, lots of handicapped spots. It's very easily accessible.
Big sign, too.
Yeah, there is a big sign.
The big sign is your first clue that you're in the right place for the walk-in clinic at IRMC. Tell me about you and your journey that brought you to the walk-in clinic, and for you to stay there and continue to work there, it must be pretty rewarding.
Yeah, it really is. We just also have such a great work culture, work environment there. All the girls that have been there for, I would say, majority of the time that the clinic's been open. So we definitely have good relationships. We have a good rapport with each other, which, of course, in any workplace makes it a lot easier just to enjoy going to work and enjoy taking care of patients. I myself actually grew up here. I'm from Indiana. I graduated from Indiana High School, and I had told my parents that I was leaving for college and I was never coming back. So I went to Slippery Rock and actually did my education there for 6 years. And of course, here I am, married, and I do have a son now. So I don't think I'm going anywhere anytime soon.
Mom and Dad probably don't mind that.
No, not at all. Not at all.
But to come back home and find a place where you're really comfortable has to be pretty important to you.
Yes, definitely for sure. And when you really look at the grand picture of work, and really any aspect of work, any occupation, a majority of your time is spent at work, So I think for me, it's also really important to work in a place that you're comfortable in, and you enjoy, you like your coworkers, and you like what you do. So that's definitely very helpful.
It's interesting that you put it that way, because I often ask doctors, nurses, PAs, whoever happens to be in the studio in the medical profession, since your background enables and actually requires you to work in other medical facilities in other cities and towns, you have an idea of what it's like elsewhere as compared to IRMC. What are the things that make working there at IRMC's walk-in clinic really nice for you? Yeah,
for me especially, I really like just the fact that we're so in touch with the community. And just growing up here, I see actually a lot of familiar faces, and even out and about just doing things in the community that don't involve work. I run into people and they always ask, hey, what do you do? And I'm, obviously explain everything. And I do get a lot of, hey, we really like coming there. Maybe next time I'll come, I'll see you. And I just really I'm generally a very outgoing person. So I like learning and talking to people. And so we do get a lot of that just within the community at IRMC, which is nice. And it's nice to have the locally owned, hospital and the managers that we get to see and talk to every day, whereas you don't really get that in larger health systems. So
I would guess that working in a walk-in clinic also, you see such a variety
we do.
Of conditions and illnesses and injuries that has to make it kind of exciting too.
It does, because you really never know what's going to walk in the door. We could have a day that we do 8 physicals in a row, and then you have a day that you don't do any, and you see a laceration or it definitely keeps it interesting.
Yeah, and that team approach too, not only within the walk-in clinic, but with the other branches of IRMC that you have access to, that really completes a healthcare picture for somebody.
Yes, definitely. And now that, of course, with us taking over the Indiana Urgent Care, to have them on board as well as Blairsville, we do work very closely with all of the staff at all 3 of those locations. So some of those providers from those locations do rotate into our location at the walk-in clinic as well. So that has just been also fun, just kind of being able to collaborate with them and working closely with them.
8 a.m. to 8 p.m. Monday through Friday.
Correct.
Walk-in clinic at IRMC. Brianna, thanks so much for coming in.
Yeah, thanks for having me.
We appreciate it very, very much. It is the voice of Indiana County. It's WCCS 101.1 FM, AM 1160, WCCSradio.com. And it's 24 minutes after 8 o'clock, just about 25 after. Matt is with us in the WCCS newsroom. He's coming up just a couple of moments. See, this is the point at which generally in our conversations I say to someone who's new to the program, how do you like Indiana? Obviously, you grew up here.
Right.
You know your way around.
Right.
Hey, Boomer Sports coming up just a second away from now. It's Indiana in the Morning on WCCS.